Our practice covers all the specialties within orthopedics. I specifically concentrate on adult reconstruction, which focuses on hip and knee replacement surgery and fixing the ones that have either worn out or are failing. I think it's very common, so especially the patient population that we routinely see, folks getting in their late 40s, 50s, 60s, they're getting to that time in their life when they can play more golf and relax a little bit more, and some into retirement. So it's a pretty common complaint as people come in with a hip or knee ailment, and their main issue is they can't play golf anymore. So it's a very common thing. We seem to have a pretty big golfing population in Chicago. I'm becoming more and more aware of just how linked every joint in your body is during a golf swing, especially a full swing during a drive or a hard swing. But everything from the way your knees are bent and moving, lots of rotation in the hip, to your spine, your shoulders, neck. I mean, everything is linked, and to have a good fluid swing and make good contact with the ball consistently and have that consistent swing is pretty important. So if you have a tweak in your knee as you pivot around it during your swing, or your hip doesn't rotate properly, specifically addressing hip and knees that I do, that can really throw off the golf swing. Absolutely. So we do know, and my sports partners are very good at this, and they take care of the White Sox and the Bulls. But as far as golf goes, weight-bearing activity has been the one proven thing that really helps cartilage stay alive. There's really no way to treat it or repair it or replace cartilage at this point. When the cartilage comes off the bone and the bone rubs on bone, that's arthritis. But the best thing you can do to preserve your joint is weight-bearing activity, and golf certainly is that. Walking 5 miles on a golf course for 18 holes is a great amount of activity. So two big things. The materials are much better. So as far as there used to be a real concern that, hey, I can't get it done too young because it'll wear out. I don't think that's an issue, particularly with hips now. My recommendation is, regardless of age, age is just a number, as they like to say, but it's on both ends of the spectrum. When that joint is worn out enough that it limits your ability to do the things you enjoy and affects your quality of life, then I think that you should consider it. I certainly would. The hips in particular, with the harder bearings that we have for the ball portion, and then the wear surfaces, the Holly Crossing polyethylene advances that they've had, I really think that these are going to last a lifetime for most patients. I'd say a good fitness program is very important, and as we get older, we tend to shy away from weight training, but I would suggest that some strengthening exercises, lightweight training, as well as some aerobic to keep your cardiovascular system in shape. All of those things can assist in your golf game as well. Yeah, so I think that in this case, the hip that we're going to talk about today, the really only significant delay is that most implants now, the bone is expected to grow into them. They're what's called press fit versus the cemented ones we used to do years ago. And that is probably a little bit, you got to be careful of that up to about the 6-week mark. But certainly putting, chipping, some light swings at 3 weeks once the incision's healed and in good shape and you're feeling good. And then 6 weeks, I'll release them to full golf. The real limitation is if the hip has become very immobile and loss of range of motion, loss of muscle mass over time. That's the hardest part to come back from. You heal the hip replacement very rapidly. It's getting that muscle strength back, that range of motion back that you'd lost over the years, and stretching those tissues. That's really the biggest delay. So the less disabled you are by it as far as loss of motion and strength, the quicker you return. And I've got people play back, full 18 holes at the 6-week mark, no problem.